Hello everybody and welcome to today's webinar. What we'll do is we'll just wait for more of us to filter in and then we'll get started. So today we'll be talking about clinical templates and we're following on from our first discussion, part one. This will be the second part two. And looking forward to diving deep into how you can get the most out of your clinical templates and tools within your Halaxy account. Fantastic to see people here already. Hi, Nikki, Karen, Jennifer, hello. Fantastic, got quite a few from Melbourne at the moment. Also Karen from Wollongong, brilliant. And we'll just wait a little bit longer for more practitioners and administrators just to come through as well. So we'll get started in a couple of minutes. But in the meantime, please introduce yourselves to each other. That's fantastic. Hello, Annie. Great to see you here. And we'll also run a poll as well. So we'll start this poll now. And it'll be great to see who has used clinical tools and templates within Halaxy before and who hasn't. So that will just help us engaging the conversation for today as well. So there's a poll that's up now. Merrily, fantastic to see you. Hello from Adelaide. Annie from the Gold Coast. Brilliant. So please continue to introduce yourselves and we're all on hand today to assist you and walk you through getting the most out of clinical templates and tools within your Halaxy account. Great. I can see already that about half of us here have never used clinical tools and templates within Halaxy. And then we have about 20% of us that do regularly use the clinical templates and tools in their Halaxy accounts, and another roughly 20–25% who have tried them but don't use them as much. So that's really helpful. So we'll cover all bases today, and I'll be able to describe every area in terms of just giving you the full rundown, so you can be up and running with all of your clinical templates and tools after this webinar. Fantastic. We'll just wait another minute and then we'll get into it. So my name is Michael. I'll be presenting today and I'm joined by my colleagues, and we have Kira, Gary, Isabella and Key with us as well. So if you have any questions, absolutely please ask away in the Q&A section just down the bottom. So just make sure that you change your chat mode to Q&A mode, and that way it flags a question and we can answer them for you. Nikki, this will be recorded like last time, and so if you need to rush off, you will have a recording, and we'll also send out the link to the previous webinar as well, so you can get access to both of those. So get access to Clinical Templates and Tools Part 1 and Clinical Templates and Tools Part 2. So it looks like the majority of us today have never used clinical templates and tools in Halaxy before, so that's great. I'm sure you'll get a lot out of today's session. Okay, all right, well, let's kick things off and we'll get started today. So provided everyone can see the screen, we're probably ready to get started. So let's talk about what we're going to cover today. So in this webinar, we're going to cover, first of all, creating a complete clinical tool. So I'll give you a step-by-step guide as to importing clinical tools, but also how you can then recreate your own depending on what your needs are. We'll then talk about building clinical dashboards within your Halaxy account. So that's how you can easily access information straight away from within your patient's profiles. And Debbie, you didn't get to watch part one. Absolutely, it's possible to view a recording of it. We'll be providing that in our weekly communication. So just have a look out for the weekly emails and you'll be able to see the link there as well. So thank you for that question. So thirdly, we'll be also talking through creating question and answer data sets. Now, that may not seem so clear at the moment. However, hopefully by the end of this webinar, you'll be full bottle and you'll understand how you can actually put together question and answer data sets, which means you can then link them to different clinical tools, and you can also view your the answers that patients provide quickly from within your clinical dashboard as well. So fourthly, we'll be discussing how you can track those within your clinical dashboards, and that's just what I mentioned there. And finally, we'll also talk through the capability within Halaxy where you can run your own clinical reports. And what we mean by that is you can actually track and you can create reports that track any type of question and answer that you've asked your patients about. So, for example, if you've tracked your patient's weight, you can actually run a clinical report that gives you all of the data relating to your patients for that particular question, which in that case would be their weight over time. So you can quickly assess how your cohorts are looking and how your clients and patients are tracking over time. So in terms of today, we'll just go through some housekeeping. If you do have any questions, please use the Q&A section just below the bottom right of screen, and we're all on hand to answer. So again, my name is Michael, and we're joined by our colleagues, my colleagues today, Isabella, Gary, Kira, and Kate, and we're more than happy to answer any of your questions as well. So thank you, Nikki and Debbie, for asking the questions. You mark them as questions, and everyone can see there in their chat. It's a red question mark, so that's helpful to identify for us the questions you'd like answered as well as we go. In terms of the poll, we did run the poll earlier, so I'll end that now, and we'll have a look at the results of the poll. So hopefully everyone can see that now under the poll section, and we can see half of us have never used clinical tools before, and then we have about 15 to 16% who regularly use clinical templates and tools within Halaxy, and also about a third who have but could use them more as well. So hopefully you'll get something out of today's session. So just bear with us. What I'll do, bear with me right now, I'll switch the screen so we can actually have a look and start this off in terms of talking about, well, what does adding clinical tools look like within your Halaxy account, and how can you start creating them? So here we go. I'll just open it up now. Fantastic. So hopefully everybody can see this screen. Please let me know. Please let me know in the chat whether you can see the screen. Janine, if you are finding the sound is cutting out, it's worth trying to reconnect. Sometimes that can help as well with the internet connection there. Fantastic. Karen, if you can't see the comments, you might just want to change your chat window to chat mode as well. That should be able to help. Aoife, sorry about that. Hopefully the internet connection works out well. And Nikki, thank you for confirming you can see the screen. That's brilliant. So in terms of what we're talking about today, what we're going to start off with is actually discussing how you can create a complete clinical tool. But firstly, what does it actually look like? So what are we working towards in terms of our Halaxy accounts? And to show you, I'll show you a sample patient profile here, and we're going to select clinical dashboard within the patient's general profile. So we're in a patient's profile, and I've just selected clinical dashboard. Thank you, Annie. So this clinical dashboard here, as we can see, there's a bit of information that's showing. We have trackers at the top, and I've also added a DAS21 tracker essentially. So we're actually seeing over time, both for this particular patient, we're tracking their weight, and also over time, we're tracking their DAS21 scores. So if I click the weight section here we go. You can actually see that that weight is being tracked over time. Now, this isn't real information or anything like that, but it shows you what you can do within your Halaxy clinical dashboards, provided you have your clinical tools and their data sets set up correctly as well. And not only that, we're also tracking scores across, in this case, the DAS21 tool. Now, if you're a psychologist, you'll be aware of this tool, or psychiatrist. However, this also shows you can actually track anything you like within your Halaxy clinical dashboard, provided it's related to a clinical tool. So we can see that the scores are being tracked across these three measures over time, and we can see when they're recorded over time as well. So I'm just scrolling down here. So this is a very simple clinical dashboard, but you can create far more complicated ones where you have multiple trackers showing, and you actually have multiple data points that you're tracking across both the trackers, but also any other types of clinical tool question and answer sets. So we're building towards something similar to this today, and what we'll do is First of all, I'll show you how you can quickly create your clinical dashboard by adding different clinical tools. But then also we'll dive into deconstructing one of those clinical tools and then how you can actually create your own as well. So right now we're tracking our patient's weight, and this question has been asked a number of times, as we can see here. We've asked them about their weight over a period of time, and we can see it's increased steadily for the most part. We've also provided them, or we've asked within a consult, DAS21 questionnaire as well, and we can see the answers are provided here. So first of all, how did we actually get this information to appear or to actually save within our patient's profile? And the answer is that we imported clinical tools that were either related to a question, in this case, what is your current weight? Or we added a clinical tool where itself, so this is a clinical tool in its entirety, the DAS21 tool, where in its entirety, we're actually tracking that within our clinical dashboard. Fantastic. So thank you for, just click reconnect if you're having any issues with the screen as well. So in terms of entering this information, first of all, where that appears is within the clinical notes section for your patient's profile. And under the clinical notes section, what we've done to add that information is essentially click new clinical note. We've then created a blank clinical note. I've imported a template, in this case, weight tracker, and click save. And we can see here now the question is asked, what is your current weight? So I'm going to enter in some information there, and we'll say 55 kilos in this case, and we'll click save. And then also remember just to click publish as well. So that makes sure that you lock that in. And we can see that 55 kilos was recorded on the 23rd of September on this particular weight tracker, which was a new clinical note. I've imported the weight tracker tool and we've added in the information there. So just like how you would enter in information within a clinical appointment, you've just entered it in to a template that you've imported into a clinical note under your patient's profile. Now, what does that mean? Well, it means if we go back to the clinical dashboard and we'll have a look here, we can see the most recent data entry was 55 kilos. And if we click this, we can actually see now that it's dropped down to this section here. Now, the reason why these are on a straight line is because they were entered at the same time on the same day. But if you realize you've entered in any data incorrectly, you can always go back and we could look for another weight tracker, say in this case here, and we're going to change that date. So I'll just revert this and we can change the date that it was recorded to say the 5th of May. And you'll see that this line now, so if I publish this, you'll see on your clinical dashboard that line should at least change in how it looks, and we can see now it has changed. So if you find that you've entered in any data incorrectly, you can always go back and revert your clinical note or clinical tool and actually change the date when that data was meant to be entered as well. So that's a helpful little tip there as well. But hopefully you can start seeing that you can actually start tracking some really important measures that you're looking to track for your patients and clients, really quite simply, provided that you have set up your clinical tools and your clinical dashboard correctly. Now, the same could be said for the DAS21 example here. If we go back to clinical notes, we import a new clinical note or create a new clinical note. Click templates. From here, I'm going to import a DAS21. We can see these are the questions here, and we'll dive into how you can actually set up something similar as well during this webinar. And I'll click save. So we've now imported that DAS21 template. And if I were to enter in the information here, I'm just going to enter it in randomly. So let's keep going. There's quite a number of questions. So we'll get there just to the end of that. Fantastic. Okay, and we'll click save, then publish. We'll now see if we can also see that it's scored. So we'll talk through scoring today and how you can set up your own scoring, whether it's weighted or simplified scoring. But if we go back to the clinical dashboard, we can now see the latest DAS21 template that we just completed for our patient is showing up at the top of the list here. So the 23rd of September, and we can see it clearly listed there for all of us. So hopefully this is starting to really paint the picture as to what you can start doing within your Halaxy account that you may not have considered before, even knew existed. But also, if you're also using clinical templates and tools already, hopefully this is a helpful illustration that you can extend your clinical tools so you can actually get more information out of them quicker and in a seamless way by setting up your clinical dashboard correctly as well. So let's dive into, first of all, we'll start actually from the backwards working forwards. So we'll talk about how I actually set up this clinical dashboard. Then we'll dive into the particular way that you can set up your clinical tools so you can start scoring and start tracking them as well. So let's talk about the clinical dashboard. Now, where this format or this structure, so the idea that we're tracking weight and then we're also tracking DAS21 responses, where we set that up, because we're currently in the patient profile right now, but where we actually established that was in settings. So settings in your menu bar and click clinical. So select clinical under settings in your menu bar, and then you'll see there's a dashboard option. So it's fourth from the right, it's at the top tabs, and we click dashboard, just there. So once we select dashboard, you may see a couple of different things depending on how many practitioners you have. So in this account, there's just one practitioner. But you might see if you have multiple practitioners within your practice, you'll have an option to modify the clinical dashboard for each of your practitioners. So your practitioners may have different preferences, and you can set up a particular dashboard for each one, depending on what their preferences are. But I'll walk you through how to actually modify the dashboard. And then if you do have more than one practitioner, it's as simple as selecting their name and then following the same steps that we're about to go through right now. So I'll select Modify Dashboard. Fantastic. And now, hopefully everybody can at least get an idea. If you can't see it as clearly, you can get the understanding that this is where our tracker is listed. And our tracker here is currently tracking what is our patient's current weight. Well, it's actually tracking the question within any clinical tool. And then we're also tracking the DAS21 clinical tool as well here to the right. So that's why those two things were appearing. Now, if we removed one, then and click save, then that would remove it from appearing in the dashboard. It doesn't delete the questions, doesn't delete the actual answers, but it does delete the appearance within the clinical dashboard itself. Conversely, additionally, you can actually add additional trackers and as many as you like. I'm just going to remove that for now. And you can also add any number of clinical templates or tools that you'd like to add as well. So this is where you can really start driving some efficiencies in your practice, but also you can start getting a really good overview of your patients' profiles. Now, the next something to point out actually is, well, what's the difference between a tracker and a clinical tool or template? And essentially, the difference here is a clinical tool is the complete clinical tool. So right here under DAS21, we're importing the entire clinical tool, and we want to see the results in their entirety within the patient's clinical dashboard. Under tracker, tracker is a particular question and its response or its answer that we're tracking. The reason why there's that distinction is because, let's say for this example, we're tracking what is our patient's current weight. That question we can actually include in multiple clinical tools. So you may have an intake form where you ask your patients or your clients what their current weights are. And then you might have another clinical tool that asks the same question. So you're looking to then compare the first information you had regarding your client's or patient's weight against their subsequent data entry or the information they provide regarding their weight. So by tracking the same question or including the same question within multiple clinical tools that you create, you can actually track that one question regardless of which clinical tool it's included within. And that means you can actually start associating the same questions across different clinical tools. Now, it might sound a little bit confusing, but if you think about it from the context that it's the same question you're essentially asking, just in different clinical tools over time, you can track that one question regardless of the clinical tool that it exists within. Now, we'll talk through how we can start setting that up in a moment. what I first want to show you is actually, well, what does the DAS21 template look like? And we'll use that as an example. And then we'll dive from there into talking about particular questions and answers and data sets as well. So let's dive into this DAS21 template and have a look at how that's structured, because what we've seen is that it's actually tracking 3 different measures. So I'll just go back to a patient's profile and we'll click their clinical dashboard just up here. And you can see that the DAS21 is measuring 3 measures here, just here, and also there's a total that's provided as well. Now that total is weighted, and these measures are actually receiving responses depending on the selections that were selected within the tool. But each selection, one either gives a certain value, so it could be anywhere between 0 to 6 or 8, but then also it's actually pulling the right types of answers, so the right types of values per answer for the right topic. That doesn't make as much sense at the moment, but I'll show you what this looks like in the background if we deconstruct the DAS21 template. And then from there, hopefully that helps illustrate to a better degree what you can do as well. Hi, Gina. Fantastic to have you here from Emsworth in the UK. Brilliant to have you on board as well. Thanks for saying hello. Okay, so let's dive into the DAS21 template. So we're going to navigate to settings in our menu bar, and we're going to click clinical. Under clinical, we can see our DAS21 appears here. So we're under clinical settings, so settings clinical in our menu. And we're just going to select DAS21. We want to edit the DAS21 template, so we're going to click the edit icon just here on the top right, the pencil icon. So now we're in our edit screen for our clinical tool. And we know it's a clinical tool because the title here says that it's a clinical tool. And what you can see, and what hopefully everybody can have an understanding of here, is there's a scoring section. And this scoring section at the moment is selected as custom, but you also have the option to select no scoring, which often is how most practitioners, administrators and practices begin. You can score per clinical note, so per the entire clinical tool itself, per section, or you can actually set up custom scoring. Now, what does custom scoring mean? We'll go into the deep end first. So we'll go to the extreme example and then work our way back from there. So we're actually scoring across 3 measures that you can see here, 1, 2, and 3. Now, these could be any measure. You could have any number. It could be 1 measure you're measuring by. It could be 5. It could be 10. It could be 20. But then we have, if we scroll down, a list of questions. And each question has a radio button, so a selection, that then associates a certain score with the response. So I'll show you here. So I find it hard to wind down. As an example question, question number 1. If we click edit, the pencil icon, we can see that the answer type is a single choice. The display type is listed as radio buttons. So that's just the type of formatting for the selection. And the data set is listed as DAS21 options. And if we click edit, I'll show you what this means. So DAS21 options, and we'll have a preview here. So we're in the edit template window. Don't worry if you're getting lost right now. It's just important to understand the high level concepts. If we view the data set, we can see that the answer options have different values depending on what is selected. So if never is selected as the radio option, well, that attracts 0 points. If sometimes is selected, that attracts 2 points. If often is selected, that attracts 4. And almost always, then the individual will receive 6 points for that particular answer. Now, hopefully what you're getting to an understanding of with Halaxy right now is that you can actually create any number of types of answers you like. So these aren't, you can define whatever type of worded answer you like or any other type of answer, and you can associate a score with that answer. And then the next step from that is you can actually associate the answer to the question with a particular way to count that score. Now, the reason why DAS21 is a good example, it's also a complicated one, is because we can show to a large extent what you can do with clinical tools. So if we now look at, say, score number 2 here, so anxiety, and we'll click, so this is the scoring section, it's pulling those scores depending on the answer provided to each question, and we'll edit the scale. We can see here that it's actually only scoring a certain number of template questions. So question 2, 4, 7, 9, 15, 19. So for DAS 21, it's important that the questions are mixed up, but you can still create the ability to score for it or score each question related to the right topic by selecting the template questions here. And then if we scroll down, and don't worry, I'm going to run through a simplified example very shortly, but I just want to give a big overview here so you can wet your feet with what you could actually build towards as well. But if we scroll down, we can actually create thresholds. So we could say when the person scores between 0 to 7, we'll say that's normal for anxiety. If they score between 8 and 9 inclusive, well, that's a mild score for anxiety. And then it goes all the way up to extremely severe, and that's if they score anywhere between 20 to 42 points, depending on their answers. Now, that's the same in terms of the structure. I just click tick there. It's the same structure for each of these, the other two options, or the two scoring methods that appear as well. So we can see that they're just different template questions that are associated with this particular topic. And then if we look along here, the assessment levels are set as well for that particular topic. And the same thing goes, I'll show you stress. Here we go. And it's listed here as well. And you can see the template questions are listed there. So this might have been a bit of a deep dive or a complicated way to begin. But really what I'm trying to demonstrate here is that you can create any number of interactive questions you like within clinical tools, and you can actually score those in any way you need as well. Now, let's actually create a simplified clinical tool, because this is the extreme, and you can always import a DAS 21 template or a similar template, depending on your profession. You'll have access to different clinical tools. But what I recommend doing is actually importing a clinical tool and then having a look by editing, by clicking the edit option, and you can see how that clinical tool was created from Halaxy's preset clinical tool database. Now, if you want to do that, just click Settings Clinical, so that's Settings Clinical in the menu, click New Template, and you'll see if you scroll to the left here, you actually have a number of clinical tools that are offered to you from Halaxy's library. Now, there's nothing stopping you from creating your own clinical tool, and that's what we're here for today as well. And if we wanted to create our own, we'd click New Tools Template, which we'll do in a moment. But what I recommend doing is actually selecting a clinical tool from the menu here, where you see there's a number of options that can be selected. Clicking Save, so you import that clinical tool, and then you're taken to the edit screen. And from this edit screen, you'll be able to see how the questions are created. You could click Edit, so you could click the pencil icon, and you can actually see where they're pulling, what type of answer type they are. In this case, it's a single choice, what display type is, radio buttons, and what the data set is. And in this case, it's pulling frequency per week. So that's a really good way of just getting your feet wet a little bit with more complicated or complex clinical tools. But now let's create a basic clinical tool. So we want to measure, let's say we're now tracking, well, actually, let's import one that tracks, we'll create a new one that tracks weight, and then we'll actually talk about data sets after and start discussing how you can actually, let's say, create a clinical tool that then tracks height from a more simplified point of view, and we might be able to add some scoring to that as well. So let's click New Template. We're going to select New Tools Template here under Create New, because it's a brand new tools template that we're creating. So we're under Settings, Clinical in the menu, and I've just clicked New Template at the top right, and now I'm selecting the New Tools Template option. So this template is entirely blank. This Clinical Tools template is entirely blank, and it's all for us to actually fill out and complete the way we'd like. So we could say weight tracker. I'm going to say number 2 just to differentiate it from the other tracker. And here we'll leave scoring just for now, because I'll just focus on importing questions. So we're going to track one thing, and that's going to be weight. Just giving it a section heading here. And what we can do is we can then add a question. So I click the add another question option. So that's adding a question. And we'll see this field now appears. And from this field, what I'm going to do is I'm going to type in weight. We can see what is your current weight is already an option as a potential or as a question. And it's important that when we're looking to link the same questions together, we import the same questions in each clinical tool. So I know that the question that's linked to the other clinical tools is this first option, and it has weight in brackets. Kilograms in brackets. Now, there's nothing stopping you from tracking pounds, milliliters, or any other type of measurement that you like. You can do anything in Halaxy. It could be temperature, both Celsius and Fahrenheit. It could also be or any type of measure that you would actually undertake within your practice. You can do that within Halaxy, and we'll have a look at a couple of those later on in this webinar as well. But let's select this weight question. So what is your current weight? And click Save. Now, we've now created a clinical tool, and we can see the template was successfully updated. This clinical tool is named Weight Tracker number 2. And we're asking one question, it's very simple, what is your current weight in kilograms? Now let's have a look at what that looks like when we import it into our patient's profile. So we'll navigate to patients, we'll click patient list. We'll click our patient here. Navigate to clinical tools, create a new clinical note, import. So I'm clicking templates. I'll just exit out of this and show you again. We click new clinical note within our clinical notes section for our patient. Under the formatting bar, we click templates to import the template we just created. And we can see here weight tracker number 2 appears to the left under your templates, because that's one of our templates. So your templates, weight tracker number 2. Click save to import. Make sure you click save, because this isn't the actual template. This is a preview. So we click save here. And now we can see a familiar screen like we saw before, and this is now tracking weight. So let's type in, let's say 70 kilograms. And as you can see, you can change this to grams, pounds, micrograms, whatever you need to, milligrams, whatever you need to do. You can change it there as well. You can also have it preset to any one of those. So we're changing it to 70, click save, publish. But what we'll do is, because it's being recorded at the same time we've already put information in, I'm going to revert that, and we'll see we can actually adjust the date as well. So revert this, and we can change the date as recorded. Let's try it in the future, and we'll click publish. So we've now added the new weight. It was recorded conceivably at 25 September, and now let's have a look at what it looks like in the clinical dashboard, because remember, that's what we're tracking. So the most recent data point appears, so we can see the 70 now instead of the 55. I'll click that, and we can actually see over time, the weight has gone from 80 kilograms down to 45, back up to 82, down to 55 over a period of months. And then in the last 2 days, it's bumped up quite remarkably from 55 to 70 kilograms. So you can see that straight away. So if you're seeing your client or patient and they're about to attend your rooms and you want to just double check their fundamentals or the vital signs as you see fit or as you see them, you could click the clinical dashboard, provided you have that question being tracked, click the graph icon, and you can actually see where they're currently sitting in terms of that question that's being tracked. So what we've just done now, and hopefully that was straightforward enough. Remember, this webinar is being recorded, so you can absolutely rewatch it later in your own time. But we've actually just created a really simple clinical tool, and the same concept that we actually did to create this clinical tool, the weight tracker number 2. So settings, clinical, under templates, I clicked weight tracker number 2. We're going to click edit. The same principle here about adding a question is exactly the same for adding more questions. So what we could do now is we could say, let's say, how are you feeling? As a question. But we don't actually have that question in here at the moment. So let's add how you're feeling as a template question. Now what we're going to start getting into, and what I'm going to start demonstrating, is actually the ability to create your own data sets and your own answer types and your own data sets as well. So Halaxy has a number of question types you can import from the Halaxy database, just like how you can import Halaxy fees and funders. You can also import different questions. So what is your current weight is an importable question, same as your height. What is your current height? However, we're going to create our own. So how are you feeling? And the answer type will be, we have a number of options here. You could either have free text. I'm just going to click, just give me one moment there. What we'll do, instead of actually adding it directly here, we'll navigate to settings clinical. And the best place to actually create your question is one under the questions tab here, but also by creating the relevant data set as well. So I'll show you what I mean by that. So this is probably the best place to do it. So under settings clinical, click questions, but we will import it into our clinical template. So let's add a question in the top right. And we can say, how are you feeling? Here we go. And we can see the grey bars that appear below are the options that we can import. But we don't have to import. You're not forced to at all. Just there to help if you see a relevant question because the data set's already associated with it. But we're asking the question, how are you feeling? And then we can select different answer types. And the reason why I've clicked this screen is because I want to show you how each answer type appears within the edit screen window. Because the other one, it will save it as you click one, whereas this, we just have an option where you have the ability to walk through each one and show how they actually appear. So if we look at this, the answer type here, we have a number of options: free text, single choice. So we could have a number of choices and only provide the option to select one for that question. As an answer, we could have multiple choices. So the same goes that you can select multiple choices from a number of options. You also, let's say you're a physiotherapist, you can actually, or any other type of profession where you need annotatable drawings, and there's not one in the Halaxy database that you'd like to use or that suits your needs, you can actually import your own drawings from any source and have them imported into a clinical tool. So you can actually start annotating them from within your Halaxy account as well. If you want to learn more about that, by all means, this is how you can add it, but click the help icon just in the top right, so the light blue question mark, and search for annotatable drawing. And you can actually get there's a really good rundown there as to how you can include different types of images or drawings that you can then sketch upon from within your patient or client's clinical notes. The other two options are you could include a numeric value. So this is what we were talking about before in terms of measurements. And this is particularly where you can start adding trackers in as well. So here, there's a number of options: microgram, milligram, kilogram, pounds, centimeters, degrees Fahrenheit, oxygen uptake, breaths per minute. So you have a number of different ways you can measure things here. And this essentially is similar to what we did before with weight. If you selected, say, grams, the question would then be, well, in this case, you'd change it to how many grams of medicine has your patient taken this week, for example, for a very simple example, and they could enter in that with the right measurement there, and you could track that over time as well, just like weight. But we're asking how you're feeling. So we're going to select single choice as the answer type, because either or. But then we actually need a data set. So let's add a new data set. We just click add new data set underneath the data set option, under questions, under clinical in settings. So settings, clinical, questions. We've created a new question, how are you feeling, and data set. And so we click add new data set because it's the first time we're creating one. And we're going to say, what should we say? We'll say patient. Yes, there we go. So we're going to measure that. We'll click add value, and one might be how you're feeling. The answer might be great. Now, I know that's not necessarily a medical answer, but this is for the sake of example here. And we can score that at 10. And let's add another value where we say not going well. And that score could be 0. Could be even negative if we wanted it to. be. And you can add any number of values here. So remember, these are the options that you're creating, and you're associating a score with each of those options. And the reason why you associate a score and why we're doing it in this case is because we're going to use that score for the answers that are provided to give a status or a response at the top of the clinical note that tells us once we've put in the, once we've actually responded to the answers, or our patient or clients responded to the answers, whether it's within our consultation or they've done it remotely through their patient portal, our clinical tool, because there's a score associated with the response, can then interpret that score and give us a response for the total of the clinical tool to tell us what the status is. So that'll make sense in a moment, but let's click save. We're saving our new data set there. Now, in terms of searching for the data set, what we'll do is I'll copy that. I'll just refresh this option. I'll just paste that back in. I'll select a single choice, and we're going to say we're going to search for patient happiness as a data set because we've created a new one, and we can click that option there. And now we can see that we've actually added it against the question itself, which is how you're feeling. We'll click save. So if you do have any issues with creating data sets and not seeing them under the questions option, just refresh the question. You may have to re-enter the information in depending on your browser, but then you'll be able to search for that data set you created. An alternative option is you can actually create data sets just like we did, but under this tab, and then create your question second. So we create the question first and data set second. That's the best way to start off with, just to see the structure. But then going forwards, it's I recommend creating your data sets first because you know what your questions are going to be, and then you create questions second. Once you've created that question, we can then add it to a template. So I'm going to click templates. We're going to click, for the sake of this example, weight tracker number 2 again. We'll click the edit icon in the top right. And then from here, we can add another question. And I'm going to search for that question. Have a look, how are you feeling? And we can see now it appears as a drop-down option because it's part of our question database that we've just created within our Halaxy account. So let's select that and we'll click save. And now we can see, if we click the edit icon to the right of that question, we can actually see it's a single choice answer type. The display type is radio buttons, but also the data set is patient happiness. So that's that data set that we just created. Now, on its own, I'll just click save. On its own, this clinical note won't actually score that question. We won't receive, say, the value of 10, or it won't interpret it in any way until we add scoring to the clinical tool, because at the moment, no scoring is selected. But we know that one of the options here, when we or our patient or client selects great, sends a score or a value of 10 within our section, within our clinical tool. So we want to be able to use that to then add a status to the top of our clinical tool. And let's do that, or add a score essentially. Now, what this example is demonstrating is you can create a number of different questions with the same data sets or varying data sets that send back a value, so a number, and the clinical tool can actually score that. So I'm going to show just one example here. But if you actually use the process that we're following here for multiple questions, and you look back on some clinical tools that you can import from Halaxy's database, you'll be able to deconstruct how that's done as well. But essentially, it's the same process, exactly the same process we're following for this one question and answer and scoring. You're just adding more questions into your clinical tool. So at the moment, our scoring says no scoring. Well, let's add scoring for the entire clinical note. So we'll add an assessment level. So this means any question that has any answer that has a value. So we can ask a number of questions here. Any question that actually provides a value, in total, we're going to score that depending on our assessment levels. So we're going to add an assessment level, and we'll say not good. And the minimum score will be 0. The maximum score could be, say, 5. It could be 0 as well. But we're just going to say 5 for now because it's halfway between 0 and 10. And then we'll add another assessment level, and that could status or the title of that assessment level we'll call great. The minimum, let's say a value of 6. So if we receive any total number of responses that equals 6 or above, then the status here, or 6 to 10, the status here will then register as great. You also have the option to hide the template score from clients and patients. That's if you share your clinical note with your clients or patients in their Halaxy health record or health portal. So if you want to learn more about that, you just click the light blue question mark at the top right, and you can learn more. But we'll leave it as is for now. But essentially focus on the scoring here. So for the entire clinical tool, clinical note, we click per note. We've set 2 assessment levels, not good and great. And we're going to click save. So in summary, we've created an ability to interpret the scoring, the values that are provided from our clinical tools, from our clinical questions, sorry. One of our clinical questions does send a value back, depending on whether we select either or options. And we're now going to see how that actually plays out when we add it to a patient's clinical note. So we're going to click patients, patient list. Go back to our familiar patient we've been writing quite a number of clinical notes for. We'll click new clinical note in the top right. So we're in our patient's clinical notes section. We've just opened up a new clinical note in the top right of screen. And now let's import that same, now poorly named template, weight track number 2, because now we actually have a question, how are you feeling? We can see that in the preview here. We're going to click save. And we're going to enter in the weight value. So let's say 105 kilograms. And let's say you're actually feeling great. We'll click save. And then what we'll do is we'll publish this clinical tool. And now what you can see is that the score for this clinical tool is listed as 10, and that has a status great. Now, if we revert this, so just keep note of that 10 great, we're going to revert this clinical tool, and I'm going to change it to not going well. Click save, publish. Always remember to publish when you're scoring. And now we can see the note has a score, the clinical tool has a score of 0 and a status of not good. So that's immediately changed once we've published the note, depending on the response that we provided within our clinical note itself. So you could set up, and the DAS21 and any other type of question and answer format is set up in the exact same way, effectively the exact same way, where it's just multiple questions. And then the scoring is where you can really start customizing how you'd like your note to be interpreted, or the clinical tool, I should say, to be interpreted. So what I mean by that is if we just go back to the clinical tool, I'll click Settings Clinical. And for this one, under this example here, just click the edit icon again, back to the same screen. We're selected per note. But there's nothing stopping you from actually having particular scoring per section. So this is one section. You can add a second section here. You can have questions within a section. So questions exist within a section and sections exist within a clinical tool. You don't have to have multiple sections, but if you want to have different scoring across your clinical tool, but the questions are all associated with themselves for one particular type of scoring, the way to do that, instead of per note, you actually select per section. And what you can see now is that under this section here, the first one, you can add assessment levels. And then under the second section, you can add different types of assessment levels depending on the values of the responses within this particular section. The DAS21, as the example, goes a step beyond this, where it's custom. And the custom scale allows you to actually say, well, this particular question value, we want to include under this particular scale. And then we want to add another scale here where we can import a different type of question. And we want to include that under this scale. So where that's particularly helpful is when within a clinical tool itself, you're asking your client or your patient questions, and they need to be in a randomized order where it's not clear what the values are associating with in terms of what score they're leading to. So that's where the custom functionality can be really helpful. And we recommend having a look at your DAS21 or a similar type of scoring tool as an example there that really helps paint that picture. So in terms of where we're at for today's webinar, what we've done so far is we've covered creating a clinical tool. We've covered building clinical dashboards. I'll dive into a little bit more in terms of tracking data sets within clinical dashboards. We've discussed creating question and answer data sets, but also so we have two final steps to talk through today. And thank you for everyone so far and your participation. Hopefully it's been clear enough, but also has given you enough to work from here. But we'll talk through tracking data sets within your clinical dashboards a little bit more just now, and also running clinical reports based on the questions that we're asking. So just as a reminder, we'll go and we'll navigate to Settings Clinical, and then we'll navigate to the dashboard, and we'll navigate back to Modify Dashboard. And this is where now you can add a different type of question as well. So let's just see if we have height as a question already. So there's no results found. Okay, so we actually can't track that question at the moment. But what we can do is, and we'll come back to that, we'll add a clinical tool. So here we'll actually add the number 2 that we've been using. The example clinical template, weight tracker number 2, we'll click Save. And right now we're only tracking 3 things, which is the current weight and also DAS21 and weight tracker number 2. Let's go back to our patient list. We'll go back to our patient, have a look at the clinical dashboard. And now we can see weight tracker number 2 is here, and the score per note, because we've created 1 note so far, is 0 because that was a score. But if we go back to that clinical note, we'll create a new one. I'm just doing this very quickly just to paint the picture for the dashboard. We're importing that same clinical note again. I'm going to select Great this time, and we'll publish this. Go back to the clinical dashboard. We'll now see that the new score is listed at the top. So you can see a record of the total score over time as well. So that can be really helpful there in terms of tracking different clinical tools and different responses over time. Now, if you wanted to add another tracker, that just requires adding a different type of numeric question within your clinical tools. So if we navigate to Settings Clinical, we'll go back to this example for now. We'll click Edit, so the weight tracker number 2. I'm going to add in another question, and we'll see whether what we'll do is we'll type in what is your current height in let's say in centimeters. Select that. We can select the answer type as a numeric value. And what we can do from there, if we click, I'll just click Save. Oh, question 3 can't be empty. Oh, that's right, because I didn't actually add it as a data set first. So we've got to do that. So add data set. Well, sorry, I've got to add it as a question because it doesn't have a data set because it's a numeric value. So click Add Question. This is a good example here. What is your height in centimeters? So we're creating this. The answer type is going to be numeric. The measurement will be centimeters for our example, and we'll click Save. Now let's go back to our clinical tool. Now we're getting back to our clinical tool, click Edit. We're going to now import that question we just created. So what is your, and we'll see it appears in the drop-down list here, what is your height? We'll click Save. Now let's go back to our patient's profile. Let's import that template into a fresh clinical note. New clinical note. Templates. We're going to import that same template again, and we can see now what is your height appears here, and we can see it's in centimeters. It could be in feet, it could be in inches, whatever you like. We're going to say the height is 160 centimeters. We'll just click Save, won't fill out anything else there. And we'll publish that note. Because that way we can actually save the scoring. We can see it's 160 centimeters. If we go to the clinical dashboard, we actually don't see the height being tracked. And the reason is because we haven't added it as a tracker. You can add any numeric value as a tracker over time. So let's do that now. So Settings, clinical dashboard, modify dashboard, and then we're going to add another tracker. I'm going to search for height because that's the question. What is your height? Click save. And now if we go back to our patient's clinical dashboard, so navigating back to our patient's clinical dashboard page, we can see that the height is also being tracked here. So over time, as you get more data points, that will then grow, just like how your weight tracker is showing the differences in time, so will this tracker here. So hopefully that's been helpful in terms of walking through how to actually edit your clinical dashboard, but also where it's being fed from. And that question in terms of what is your height, you can actually include in multiple clinical tools. And that means that whenever that answer is provided, regardless of where that question exists within your clinical tools, it will then update your patient's profile automatically for you over time. Now, there's one final section that we're yet to cover, and I'll do that just now. So thank you for sitting through and hopefully learning a few things about Halaxy's clinical tools today. We'll finish up in a couple of minutes. And the final step is actually running reports based on the clinical information that you're building. So you can do that. You can understand your cohorts to a greater degree by running reports, a patient report. If we click new report in the top right, you can actually change your report type here to clinical reports. So under reports, patient, you can select clinical reports. And then from here, you can actually select your template question you'd like to track. So we've been tracking weight quite a bit. So we're going to see our entire cohort. And you can filter down by age, by gender, by the patient names or the practitioners as well. And you can also filter by equal than, less than. So you can actually look in terms of your cohort for those that are less than a certain weight for this example. But we're just going to run a general report on clinical reports. Click run. And now what we can see is our first patient and second patient have had their weight tracked over time. And we can actually see that score over time listed here and the date when it was answered as well to the right. So you can actually start building out some really interesting ways that you can track your patients and your cohorts so you can provide a better service over time and actually keep up to date with how they're going at a higher level across your entire client or patient base, or to the level of the degree that you'd like to assess that. So you can always export your reports as well. So if you want to edit these in any more detail, you can do that by exporting, clicking this icon on the top right. And if you want to have a look at what this looks like on the graph for each of your patients, you can click the graph icon here, and it's the same thing we saw in the clinical dashboard. So in terms of today, what we've talked about and what we've talked through is creating a complete clinical tool, building clinical dashboards, creating question and answer data sets, tracking data sets within clinical dashboards, and running clinical reports. And I realize in large part, we've only just scratched the surface here in terms of the power of what you can build into your Halaxy profiles. But we hope that it's been helpful. And thank you for everybody for your questions and your inputs throughout today. Hopefully we've been able to answer as much as possible. And thank you for your time today as well. We've appreciated it. So if there's any more questions that you have, we're available on the phones right now. We're available 18 hours a day, Monday to Friday, but also by email at community@halaxy.com. And you can always, if you want a question immediately answered, you can check out our great help guide here in the top right by clicking the light blue question mark. So you can click the light blue question mark here, and that will take you to the help guide. And if you have any questions from today, by all means, just search for that in the help guide. That's a great first port of call, but we're always here to support and help you as well in your practice success. So thank you very much for your time today. We've really appreciated it, and it's been great having everyone with us. Thank you, Felipe. Thank you, Gina. Thank you, Morgana. Thank you, Kirsten. And we'll leave it there for today. And the recording will be available from tomorrow, but also we'll be providing details as to the first recording for part 1 later on as well. So keep a lookout on your emails too. So on behalf of all of us here at Halaxy, thank you for your time, and we wish you all the best in your future endeavors. And hopefully Halaxy is a big part of that. So thank you very much.